Hello everyone, I'm Dr. Upasana. I'm a consultant gynae oncologist, and today I welcome you all to our KickStart series of MRCOG Part 3. And today we'll be dealing with the oncology module, and I'll be going through a patient simulated task on HPV positive smear. I have Dr. Swati here with me, who has graciously agreed to be a role player. So welcome, Dr. Swati. Before we begin, let us begin with a quote that greatness begins beyond your comfort zone. So you work hard to achieve something great, right? Okay, so before we move ahead with the patient simulated task, let me give you certain tips regarding this oncology module. So these are some of the commonly asked patient related tasks. They can be asked either in the form of a structured discussion or a patient simulated task. Mainly you can get topics from cervical screening, HPV testing, and cervical cytology reports. It can be asked either in the form of a structured discussion or a patient simulated task, and counseling on HPV vaccination program, endometrial hyperplasia, pre-malignant lesions of the cervix, endometrium, and vulva. Something related to the carcinoma of the cervix, maybe how you'll manage it. The patient has come to you with a biopsy report, endometrium, vulva, and choriocarcinoma. So most important thing in this types of topics is how you break the bad news to the patient, which is really very important. In an oncology module, you should be very well versed with how to break the news to this patient. Okay. Now, borderline ovarian tumor, how to explain the entire entity of borderline ovarian tumor, counseling a lady with a BRCA gene for risk-reducing salpingo-oophorectomy regarding the familial inheritance, etc. The importance of MDT. Whenever you are going through the station is on oncology, you should remember at least two things. One is they will test you somewhere or the other on how you are breaking the bad news. And number two is regarding MDT. You have to utter this term MDT in almost every oncology module. So involving your senior colleagues, having a referral pathway. There is a strict cancer referral pathway followed in the UK, which you need to be aware of. And what are the investigations and treatment in broad they want to know from you. They do not want to know the details from you. You should deal sensitively with areas of palliation and terminal care, what to provide as an alternative, providing them in contact with some support groups, helping them out. So that is something which is very important in an oncology module. You need to tell the patient what a chemotherapy, radiation therapy works on, how to explain and how to go about this entire chemotherapy, radiotherapy thing is very important. And the most important part is how to deal with breaking bad news, where because the patient is most often in denial that, do you mean to say that I have cancer? So something like that, and she is more in a phase of denial. So how you convince her and then she will show her grief that I'll die, doctor, what will happen to me? Does that mean that I'm going to die? So how do you tackle these questions is the crux of the oncology module. Most often than not, oncology module can be asked as a lay examiner task, where the lay examiner actually assesses you on how good or how well versed you are in your communication skills. So communication skills are very important while you are dealing with the oncology module. As far as the applied clinical knowledge part is concerned, it is not much in detail that you need to know regarding oncology. Just the bare basic concepts will suffice. But yes, to work, you have to be very good in your communication skills, and you should know some bit of cancer survival statistics, so that when the patient asks you, how long do I have, doctor, you can give her an idea regarding the cancer survival. Okay, so these are the most important tips and tricks of an oncology module. Now we'll move ahead with our station that we have, that is on HPV positive smear. So here I'll just read out this the entire scenario. So whenever you get such station, you get 2 minutes time. So please make it a habit that to note down whatever is the important or the keywords which you need to mention while you are enacting the entire thing. Okay, so here I'll just go on. I'll read, and at the same time I'll just try and tell you how to go about whenever you get a station like this. So Mrs. Ellen Gray, she is 35 years of old, has come for a consultation with your consultant as referred by the GP. So she is somewhat referred by the GP. You are in ST5 in the colposcopy clinic. So this is number one, that you know that you are in a colposcopy clinic. So most likely this is going to be an oncology module. Number two, your consultant is away for an emergency surgery and has asked you to see the patients on his behalf. So you have to start your consultation by saying that I'm sorry that the consultant is away. So this is number two important point that you can get from this entire question. A copy of the referral letter is attached. Now you need to see which are the modules you are being tested on: information gathering, communication, patient safety, and applied clinical knowledge. Okay, so these are the 4 modules you are being tested on. Now coming to the referral letter. So the GP has given you a referral letter. You should mention at the end that, yes, I'll write back to the GP and I'll tell them regarding the management. So Mrs. Ellen Grace, 35 years, I would be pleased if her recent cervical smear showed high-grade dyskaryosis and high-risk HPV positive. Nulliparous, it is already mentioned she is nulliparous. Please do not repeat the question. And the rest of her medical history is unremarkable. Medical history is nil, right? So marks will be awarded. Always see this where are they asked, they will be getting your marks. So please go through the question very carefully, because if you go through these small tricks, it will the marks will accumulate and you will be able to clear the exam very easily. So relevant history taking is very important. Discussion of relevant investigations, what are the further investigations you want to carry out, and any treatment options if it is applicable. Okay, so let me just start this so these are the role player instructions. So let us start the discussion where I am the candidate and Dr. Swati, she is the role player. So hello, I am Dr. Upasana, one of the doctors in the colposcopy clinic today. May I know your name and age, please?
Yeah, doctor, I'm Ellen Grace and I'm 35.
I'm sorry to say that my consultant is away for an emergency surgery. So is it okay if I continue the consultation on his behalf?
Oh, okay, it's okay, doctor. It's fine, you can continue.
Thank you so much. Thank you so much. How may I address you?
Alan is fine, doctor.
Okay, thank you so much, Alan. So I've gone through your GP letter and I can see that your recent cervical smear has turned out to be high-grade dyskaryosis and high-risk HPV positive. Can you tell me more regarding this? Do you know anything about the report?
Yes, doctor, my GP told me that I'm having certain abnormal cells on my smear. And, you know, one virus is there. He mentioned some HPV virus is positive. So I'm basically concerned, doctor, that is it a serious thing? Do I have something like cancer? Because, you know, I'm very worried about this. He referred me to you guys in the colposcopy clinic. So I want to know what is this? What is colposcopy? What it involves? What would be my further treatment?
Yes, Ellen, I can understand. I can understand that you are anxious, and I will be happy. I'll be glad to answer all your queries. But before I move ahead and discuss the reports with you, is it fine if I ask you a few questions to know more about you?
Yeah, doctor, go on. Yes.
Okay. So can you tell me more regarding your periods? When was your last period? Are they regular? Do you have any irregular bleeding or bleeding between the periods?
Yes, doctor. Actually, my periods are on the whole normal. My last one was 2 weeks back. But yes, since last 5 to 6 months, there is some spotting in between my periods. And
Okay.
one more concern, which I think might be concerning, that after intercourse with my partner, you know, I bleed a little bit from down below.
Okay, so did you experience any pain during your intercourse?
No significant pain as such, doctor, just bleeding.
Okay, so can you tell me, do you have any history of any sexually shared infections maybe in the past?
No, nothing like that, doctor.
Okay, okay. So I presume you are regular with your smears, or did you have
Yeah.
any treatment before?
No, doctor. Actually, I was very particular with my smears because, you know, my mother also had cervical cancer. and she
Okay.
had it at around 38 to 40 years of age. So I was very particular for my smears, and I used to have them regularly. Everything was normal up till now, but only this time it turned out that I got this letter that some abnormality has turned up. So, I'm really concerned, as my mother also had the same thing.
Okay, I'm so sorry to hear that your mother had cervical cancer, and how is she doing now?
Doctor, she's okay, but yes, she's undergoing radiotherapy and chemotherapy and those things. But yes.
Okay. Okay, okay. I'm so sorry to hear that. And however, please, that's a very good thing that you're up to date with your smears, and please do be up to date with the smears, and please follow the cervical care screening program by NHS that we are advising, how the way we are advising you. That's really a good thing. And I see that you do not have any kids. Are you planning to have any kids in the
Yes,
future?
doctor. Yeah, doctor. Actually, I'm trying for a baby. Me and my partner are trying for a baby.
So that means you're not on any contraceptives now, right?
No, doctor. Yes.
Okay. So I can see that you're generally fit and well. And do you have any history of any surgeries in your tummy in the past?
No, doctor. Never before.
Okay. So can you tell me, do you smoke?
Yeah, doctor. I take almost 15 to 20 cigarettes a day.
Okay. So, Alan, have you ever thought about quitting smoking?
Uh, Actually, doctor, it's been very difficult for me to quit. But yes, if it would in any way help me with my condition, or if it would in any way pose me to a risk of cancer or anything, I will consider quitting it.
Yeah, so the thing is here, Alan, smoking actually impairs your immunity. Okay, so it helps other viruses like HPV to grow. So it actually slows down the natural elimination of the HPV virus, which our body can do. Okay, so it's always a good thing if you try and quit smoking. Anyways, I'll refer you to the NHS Stop Smoking Services so that they will guide you regarding this entire thing. And do you drink alcohol?
No, doctor. Very occasionally.
Okay. And what about recreational drugs?
No, doctor. Never.
Okay. Can you tell me about your BMI?
Yeah, doctor, it's a bit on a higher side. It's 26, doctor.
Okay. And what do you do for a living?
Doctor, actually, I work as a legal secretary.
And you are living with your partner?
Yeah, yes, doctor.
And how is support at home?
Support is great, doctor. He is quite supportive, my partner.
So have you been feeling low, depressed, or down in the past couple of days?
No, doctor, not actually. But since the time I have received this letter, I'm really concerned.
Yeah, that I can see. Don't worry, we are just coming to that shortly. And any allergies that you would like to mention? Any drug or any substance allergies?
No, doctor, none that I know of.
Okay, that's good. And can I just examine you in the presence of a chaperone with your consent, if you're okay?
Okay, doctor, fine.
So thank you so much, Ellen. So now if we come to discuss regarding your results, so your smear test has come out to be abnormal. Okay, so your smear test has come out to be abnormal, but however, this is not cancer. This is something known as pre-cancer, that is a stage which occurs before cancer, and we have detected this stage early. But however, whenever we have a report of a smear, it can be of three types. That is, it can be borderline, it can be low grade, or it can be high grade. Yours report has come out to be high grade. That means it is something, the abnormality is of a severe type. Okay. So your abnormality is of a severe type, but please do not worry, because this entire thing needs to be again rechecked with a machine with a microscope known as colposcope. So what does this colposcope thing does? With the help of a colposcope, we'll be able to examine the neck of your womb. Okay, so the colposcope helps us to see or get a magnified view of the neck of your womb. So when we are doing this examination, we'll just put your both legs in a stirrup and we will apply some special solution into the neck of your womb and then examine your neck of the womb under this magnifier or this microscope, which is known as colposcope. Am I clear, Ellen, or do you have any questions?
Yeah, doctor, I get it. I get it what the procedure involves. But is this virus thing my GP was saying, HPV? How is this thing related to my risk of cancer? Or why did it happen to me only?
HPV virus. So let me tell you regarding HPV virus. So HPV virus is human papilloma virus and it is a very common infection. Okay, so please do not worry. HPV is a very common infection and by the age of 50, around 8 out of 10 women have this, sexually active women have this virus in their body. However, most of the women are able to eradicate this virus via their system, from their body, via the system. However, in certain individuals, these virus can stay back in the neck of the womb and cause these changes into the neck of the womb, which we have detected with the help of a cervical smear. Okay, so this virus actually, if it stays behind and it causes some changes in the neck of the womb, it can lead to this precancerous or this pre-cancer stage. And later, if this pre-cancer stage was not detected or is not treated adequately, it may lead to cancer. But however, let me assure you, now at your stage, you do not have cancer and we need to do this test right away. After receiving your report, within 2 weeks, the colposcopist will see you and do the necessary examination of your neck of the womb. Is it clear, Ellen? Or do you have any further
Yes, doctor. No, doctor,
Okay.
it's quite clear. Yeah. Have I contracted it sexually?
Yes, HPV virus is something which is transmitted sexually, but it is a very, as I already mentioned you, it's a very common infection and around 8 out of 10 of sexually active women have this infection. Okay, so this is a sexually transmitted virus, but yes, it is very common.
Okay, doctor.
And having this virus doesn't mean that you have cancer. Okay, let me clear this for you.
That's quite somewhat relieving, doctor, because actually I was very anxious that I have already had cancer, So, doctor, what further? Suppose if colposcopy confirms these abnormalities, then what next would be done, doctor?
Okay, so first, when we are doing this colposcopy, so I have explained you how the colposcopy thing is done. And once we examine the neck of your womb, and then depending on the colposcopy results, depending on what we are able to see from the neck of the womb, we can decide for two things. One, we can do the treatment at the same setting. That is, we do treatment. I'll come to the treatment options that we have for you. Or we can just take simply a biopsy or a small tissue piece and we can send it for examination. So these two things can be done based on your colposcopy results. So in case we just go for a small tissue or a small biopsy, then we will act based on what the biopsy report comes out to be. And in case that we will offer you a treatment later on. But in case we decide that yes, we have to go forward in the form of a treatment, then there are two types of treatment which is available. One is what is known as a LEDS procedure. So what is a LEDS procedure? Here a heated wire loop will be used to remove the abnormal area or at the neck of your womb. So this is usually done by numbing the neck of your womb. And the other procedure which we can do is a cone biopsy. That is, a cone shaped tissue is taken from your neck of the womb, and this is again sent for examination under the microscope. And for this test, we have to make you sleep. That is, this is carried out entirely under anesthesia. Okay, so am I clear, Alan, or do you want me to repeat anything?
No, doctor, I get it. I get what the treatment would involve. Yeah.
Okay. Thank you. Thank you so much, Alan. So I'll just book an appointment with my consultant so that you can have a word with him, as well as I'll book an appointment for your colposcopy. I'll write back to your GP regarding what the management that we are offering you. And I will also get in touch where I'll put you across, I'll give you some patient information leaflets so that you can go through this procedure at your time. Okay, so thank you so much.
To get this procedure, doctor? How soon do I need to get this done?
Usually we in NHS we have this protocol of getting the test done within 2 weeks of you having your cervical smear reports.
Oh, fine.
So we'll get this scheduled within 2 weeks so that we can have the treatment or the reports as early as possible.
Okay,
Okay?
Fine.
So anything else I can help you with, Alan?
No, doctor, it's fine.
Okay, thank you so much. Thank you so much, Alan. It was lovely interacting with you. Thank you.
Thank you.
Thank you. Thank you, Dr. Thank you so much. So this is how you need to interact, and maybe so this is the way mostly. So these are the questions which she may ask. The first and foremost question is whether I have cancer. How did I get it? She may say that my husband is unfaithful. Then you need to tell her that no, HPV virus is not exactly, it is something very common infection. It can be occurred in any type of sexually active women. So it is not that your husband is unfaithful. And can this be treated? Yes, you need to tell her regarding the all treatment options, what you are going to offer her, everything. And in case she asks you regarding pregnancy, because if you're doing a LEDS procedure, you need to tell her regarding the complications of LEDS procedure. So whatever the main crux of the story is, whatever the role player is asking you, please pay heed to that and please answer all her questions, because whatever the things she is answering you, if you're answering them, that means you're getting tick, tick, tick in your scorecard. Okay. So this is what it is. So information gathering, this is all that we have discussed now: menstrual history, sexual history, STI, and fertility concerns, contraception history. Smoking history is very important because it's a risk factor for cervical cancer. Then examination of with a chaperone, allergies. She may have iodine allergy. Then you are supposed not to because we use Lugol's iodine and acetic acid during colposcopy. So this is how you explain what an abnormal smear is all about. You can just go through them the same way which I explained to Ellen here, Dr. Swati here. So please emphasize on your fact that this is a pre-cancerous lesion and this is not cancer. Okay. She may also ask you that whether this is something which I have inherited from my mother. Then you need to reassure her that no, this cervical cancer is not known to be inherited. It does not have a familial inheritance. Okay, so this is something important. Before colposcopy, if you have time, then you can advise that yes, please do not have penetrative vaginal sex, do not use any vaginal tampons, and in case there is any there can be some minor bleeding, please bring a sanitary pad or a panty liner. And during colposcopy, the way it is done, placing the legs in the stirrups, putting on the microscope, putting in the speculum, and yes, there are two options. They can straight away go for a biopsy or they can go for a LEDS or a cone biopsy. So LEDS procedure, we can do it under local anesthesia. Cone biopsy usually requires general anesthesia because of a high risk of bleeding. So in case she has a LEDS or a conization, she can have some side effects like bleeding, infection, cervical stenosis. You need to give the contact number of the GP, that is 111, all these things. Okay. And as far as the results, if she asks you what will be my results from what are the possible options of my results, then she will get the results by the term CIN, or it can be absolutely normal or CIN. So CIN 1, 2, 3, depending on what are the chances of the cells becoming cancerous. A higher number means a higher risk of cancer developing if the cells are not removed. And towards the end, always write back to the GP, because there was a GP letter. Write back to the GP, arrange an appointment with the consultant, because she came to have a word with the consultant in the beginning. Okay, and please refer her to the support groups and the patient information leaflet. So this is the referral pathway. This is very important because Ellen specifically asked me when will I schedule the appointment. So it is within 2 weeks in case of high-grade dyskaryosis. Please remember that, because these are some pinpoint questions they can ask you as far as your applied clinical knowledge part is concerned. Okay. Now, patient safety. This is the entire thing which I told you regarding HPV infection, and cancer cervix will not follow a familial pattern. please keep on reassuring her that this is not cancer. And the way you interact with the patient is very important. When she told you that her mother is of cervical cancer, you need to show empathy to the patient. So if it is a lay examiner station, you will be marked on these communication skills. And if you show empathy, you will be scoring good marks. Okay. Offer advice to lower the risk of cancer, that is smoking. Smoking impairs the immunity, slows down natural elimination of the virus, and emphasize on the importance of follow-up. Communication skills, always maintain eye contact, apologize for the consultant's absence, ask permission to carry forward the consultation. Always, please avoid using jargon. Every time I have used neck of the womb or microscope, once I will just tell, okay, colposcope is microscope. And after that, you have to be very particular. Please do not avoid using this jargons, okay, medical jargons. And always check intermittently whether the patient has understood the information. Just give us some information and then ask again. Okay, is it clear to you? Do you need something for me? Please do not rush through, because you have to complete everything in 10 minutes. That doesn't necessarily mean that you have to rush through the thing, that something it's there, you have to complete this things. That doesn't really matter. The most important thing is both your communication plus your information gathering, which should be over by 4 minutes. Okay. And right back to the GP. In case you guys have any question, we will be glad to answer. Please write them in the chat box, and please follow our Kickstart series of Study Medic. And we have come up with this innovative idea in order to motivate you guys and help you crack the Part 3 exam and become a member of the Royal College of Obstetrics and Gynae. So thank you so much. Thank you so much. Thank you, Dr. Swati. Anything you would like to comment? Yes. Yeah.
Ma'am, it was a
Anything, Dr.
beautiful
Swati?
presentation. It was a beautiful presentation, I think, ma'am, and really you covered almost all the points which the students need to know how to clear this station. So quite a very beautifully performed station, ma'am, and very nice tips given on how to crack any station of oncology. Thank you that you provided me an opportunity to be a part of this. Thank you.
Thank you. Thank you so much. Thank you so much, Dr. Swati. Thank you. Thank you. Thank you, Aishwarya. Thank you.